Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to Informed Immunity, the podcast dedicated to bringing you the latest evidence-based information on vaccines, community health, and the fight against infectious diseases. I'm Susan Jara, Director of Patient Education at the Global Healthy Living Foundation, and your guide on this journey to better health. In this audio guide, we're tackling some of the most common myths and misconceptions about vaccines. We'll break down the facts to help you feel confident in making informed decisions about vaccinations. Whether you're worried about vaccine safety or simply curious about the truth behind the rumors, this audio guide will provide clarity and insight. Today, we're joined by Samantha Picking, pharmacist and Director of Immunization at Walgreens. With her extensive experience in developing immunization strategies and ensuring equitable access to life-saving vaccines, Samantha will help us debunk these myths and explain how vaccines truly work to protect our health. Before we get to the vaccine myths, Samantha, can you please briefly remind our listeners what are vaccines and how do they work to protect our health?
Of course. So what I want to remember is vaccination is the number one way that someone can protect themselves or their loved ones against serious disease and respiratory illnesses like flu, COVID, and RSV. Getting vaccinated prevents illnesses, medical visits, hospitalization, days away from work, and even death. When it comes to flu, COVID, or other illnesses that we're preventing through vaccination, there is a chance that some people get vaccinated still feel sick afterwards. But their symptoms and severity of illness, if they do end up getting those diseases that we're preventing, are reduced significantly because they got vaccinated. Now, vaccines work by stimulating the body's immune system to produce antibodies. They do this by limiting an infection, the presence of a disease-causing organism in the body, to engage the body's natural defenses. Vaccines are usually administered through needle injections. However, there are some that are administered by mouth or sprayed in the nose.
Thank you, Samantha. That was a great overview. Now that we have this basic understanding of how vaccines interact with our immune system, let's tackle some of those common myths. Let's start with, is there any evidence that vaccines cause autism?
This is a big one that's out there, and there is no credible scientific evidence linking vaccines to autism. There was an original study that suggested there was a link. However, that study was found to be fraudulent and was retracted. Its author also lost his medical license due to these ethical violations in the study. And there have been multiple large-scale studies. There are tons of vaccinations that have been done over the years, and these studies included those by the CDC, the Institute of Medicine, have confirmed that vaccines do not cause autism.
Yeah, that is a big one. Thank you so much for clearing up that major concern for, so many listeners out there. What about the claim that vaccines can cause the diseases they're supposed to prevent?
Yeah, and sometimes this may feel like it because you get side effects after you get a vaccine. And again, they're rare and small, but there is no way vaccines can cause the disease they are meant to prevent. So some vaccines actually contain an inactivated form of a virus or parts of a germ, which cannot cause disease. The flu vaccine, for example, it's manufactured using what's known as dead or inactivated virus, so it really cannot cause influenza for a person receiving that vaccine. In addition, there are vaccines that are known as live attenuated vaccines. So they have a weakened form of the virus, but they can't actually cause the illness itself, especially in healthy patients.
Thank you. I'm so glad we have that myth debunked that you can't get the flu from getting the flu shot. Another common question people have is whether natural immunity is better than vaccine-induced immunity. Can you please explain this for our listeners, Samantha?
Of course. Vaccines provide a safe way to build immunity without the harmful effects of the disease itself. Now, natural immunity may occur after infection. However, the risks of the disease are far worse than the risk of actually getting a vaccination because we know those are safer. If you're actually getting the infection, say flu, you could be suffering from severe complications, severe illness, or even death if you are choosing to go with natural immunity versus getting a vaccination.
Thank you. And, I think that's definitely worth reiterating that vaccines provide a safe way to develop immunity. And I think there's a lot of misconceptions about immunity, especially when it comes to COVID-19. For example, if you've received your COVID-19 vaccine during the beginning of the pandemic, do you necessarily need to get another one?
Yeah, that's a great question. And at the start of the pandemic, we really weren't sure. We didn't know how COVID would react as a virus. Now, natural immunity from having COVID-19 may not provide that long-term protection, and reinfection is possible. Stronger defense against variants. We now know that COVID-19 virus changes, similar to what we see with flu. So that allows us to change the vaccine and better protect against the newer variants that are surfacing for COVID-19. And the vaccines are helped to design to protect against those different variants as the virus change on us. Now, public health benefit to getting the vaccine. Getting vaccinated helps reduce the spread of virus to others. You may not feel like you need it because you've had the infection. However, a major benefit of vaccines is protecting those around you, whether it's your grandparents, little ones, or just people in the community that you're interacting with that you may not realize have weakened immune systems.
Yeah, thank you for that. Public health benefit is just so important, especially for so many of our listeners who are immunocompromised or who take immunosuppressing medication or who have loved ones who are also immunosuppressed. And, this kind of makes me think of another concern about receiving vaccination. Can receiving too many vaccines overload our immune system? Could you please address that, Samantha?
The one thing to remember is our immune systems are amazing. They are capable of handling exposure to thousands of antigens daily that we don't even realize we're exposing ourselves to. So, no, receiving multiple vaccines at once does not overload our immune system. It's designed to do that. Vaccines are only a tiny fraction of what the immune system encounters daily. According to the CDC, even side effects of vaccines are generally the same when given with other vaccines. Just on Monday this week, I got both my flu and COVID vaccine, and I've had both of them separately, and I've seen no difference in terms of how I feel after those vaccinations. So they may vary by individual, but it's important to remember that even if you do experience those common side effects like headache, fever, pain, swelling, it just means the vaccines are working. It's also shown in studies that combination of vaccines is safe and effective. According to current CDC guidance, it's safe to get multiple vaccines at the same time, whether it's flu, COVID, RSV, pneumonia, or really any vaccine you may be missing at that moment. It's better to get protected when you're there getting vaccines than allow for any additional gap until you get that vaccine.
Let's explore the topic of vaccine side effects, which is another area that generates a lot of questions and concerns. Do vaccines cause severe side effects?
What I can tell you, Susan, it's a great question. Severe side effects from vaccines are extremely rare. The most common side effects are mild, so soreness of your arm or soreness at the injection site, maybe a low-grade fever. But the benefit of vaccination far outweigh the small risk of any side effect.
Speaking of seriousness, let's touch on whether these vaccine-preventable diseases are really as serious as they seem. Is this something that individuals should worry about, developing flu, RSV, COVID, pneumonia?
Absolutely. Vaccine preventable diseases can be very serious and even deadly for people, again, with compromised immune system, taking immunocompromising medications. And while I may be healthy, I may be also exposed to people that are immunocompromised. So I'm protecting them by getting my vaccination. And just as an example of this, flu can cause mild to severe illness and at times can lead to life-threatening complications. Pregnant women, young children, seniors are really at the highest risk for complications when they contract flu. In addition to communities of color, Black, Hispanic, Native American communities tend to experience higher rates of severe illness and hospitalization from the flu, often due to decreased vaccination rates, but also socioeconomic factors. And then those in rural communities that may not have access to healthcare if they are experiencing a severe reaction to, say, or complication from flu. RSV, very similar, can be anywhere from mild to severe, ranging from just a cold to having severe lung infections like pneumonia or other complications. And again, this is a lot for the younger population, so infants and also older adults. As an example, my kids had RSV when they were little, and from that ended up with pneumonia, ear infections. I've had 2 kids in the hospital from RSV, and it's just really something I wish I had a vaccination at that time to prevent from having to go through that with my children. Also, vaccines prevent against severe outcomes and help maintain public health. Getting vaccinated is the most important thing that you can do to help protect yourself and those around you In addition to vaccination, everyday preventative actions helping reduce the spread of flu, COVID, RSV during respiratory season. We are about to enter respiratory season, and this is so important. So avoiding close contact with people who may be sick, covering your nose and your mouth when you sneeze, washing your hands often, avoiding touching your eyes, nose, and mouth. All these additional things, in addition to getting vaccinated, is so important this time of year.
Thank you. Thank you for putting things in perspective and offering just tangible advice that, our community can use on a daily basis to stay safe. Access to vaccines is so important. And I know Global Healthy Living Foundation and Walgreens work together to really, promote access, which is so important. It's really important to remember that vaccines are not just about individual protection, but about community health as well. So thank you so much for joining us today, Samantha. We've covered a lot of important information about vaccines and debunking common myths, and let's hope we address some common concerns, and you definitely provided evidence-based information to help our listeners make informed decisions about vaccinations.
Susan, thank you so much for having me today. I really enjoyed this conversation. It's so important.
This is Informed Immunity. Thank you for joining us on this audio guide. Remember, the fight against infectious diseases is a community effort, and your participation is crucial. For more reliable information on vaccines and to stay up to date on the latest in public health, visit our website at ghlf.org or check out the Centers for Disease Control and Prevention or World Health Organization website. This podcast was made possible with support from GSK. If you enjoyed this episode, please rate our podcast, write a positive review, and share it with your friends and family. It will help more people like you find us. Until next time, stay informed and stay healthy. Together, we can make a difference.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.